the topic of discussion that we are going to cover is we are going to talk about gastrointestinal stromal tumor, right? Okay, now before this lecture we talked about what? We talked about adenocarcinoma, right? Gastric adenocarcinoma. So in beginning we talked about different tumors. So these are the different tumors. So right, in this discussion we mentioned that this gastrointestinal stromal tumor, it is the most common mesenchymal tumor, right? Most common mesenchymal tumor of our gastric region. So now without delay, let's begin with our discussion. In this discussion we'll be covering all these points, we'll be discussing all these diagrams. So now without delay, let's begin it. Now yes, we have already mentioned what? It is the most common mesenchymal tumor of stomach, right? Now every tumor has its origin, right? Similarly, it has its origin, and the origin right here is our cells of Kegel. Cells of Kegel. Now what is the cells of Kegel? One important fact about the cells of Kegel is it is the pacemaker of our GIT, right? It is the pacemaker of our GIT, right? As we have pacemaker in our heart, that is SA node, right? It is pacemaker because it makes firing, it has what? Highest firing rate, right? Rather than other cardiac tissues. So similarly here our pacemaker cell of our GIT is our cells of Kegel. Okay, now since we have said that our mesenchymal tumor of stomach, it arises from where? It arises from the pacemaker cells of GIT, and that is what? Cells of Kegel. So what will happen is there will be mutation in these cells, right? Cells of Kegel. Now because of mutation there will be increase in proliferation, right? There will be increase in number of cell, and that is especially due to overactivity of tyrosine kinase. So it is so important, we need to memorize this, that the main cause of this gastrointestinal stromal tumor is what? Our tyrosine kinase. Now moving further, what we are going to do is we are going to study about what? About pathogenesis, right? We are going to study about pathogenesis. Now I would like to mention something right here. Okay, and the thing is, okay, this tumor, our GIST is sporadic, right? Sporadic. Especially it is sporadic in about 95% of the cases. It is sporadic, and talking about other things such as about around 5% it is familial, right? Familial case. Okay, now talking about familial, right? Familial case of our GIST is related to NF gene, right? NF gene. Now talking about what? Talking about sporadic condition, right? Talking about sporadic condition, it is linked with multiple type of mutation. Now what are the mutations? Multiple type of mutations. The mutations such as what? Our mutation in CKIT gene, right? Mutation in CKIT gene. So this is the mutation in CKIT gene is the most it is the most specific one, right? It is the most specific one. Now we will just mention different genes in descending order, such as this is of maximum, right? In maximum cases we'll find CKIT gene, right? Mutation. Similarly we have what? We have platelet derived growth factor, right? Alpha mutation, right? We have CKIT, we have platelet derived growth factor mutation. Similarly we have what? We have succinate dehydrogenase subunit B, C and D. What I'm saying succinate dehydrogenase what? B, C and D subtype. Okay, now these are what? These are different several mutations. Okay, now there is one important correlation that I would like to mention right here, and that is when the person is having succinate dehydrogenase subunit BCD mutation, at that time this patient also may present with another condition, and that another condition is what? That another condition is our paraganglioma. What I'm saying? Paraganglioma. Okay, that means if the person is suffering from succinate dehydrogenase subunit BCD mutation, at the time there can be the condition, and that condition is what? That condition is our paraganglioma, right? Now these two, right? The dyad of these two condition and these two together, right? The dyad of our succinate dehydrogenase mutation of BCD subtype and our paraganglioma, these, right? These are together called our what? These are together called Carney stratakis, right? What I'm saying? CARNEY, Carney, STRATAKIS, stratakis, right? Stratakis. Now, okay, now there is one word, right, that we are trying to correlate with it is, and one condition is there that we are trying to correlate with this Carne's strategies, and that is our what? Carne's triad. C-A-R-N-E-Y, Carne's triad. Now what is this triad? Carne's triad. This Carne's triad and our Carne's strategies are different thing. Okay, this Carne's triad, what this Carne's triad include is, this Carne's triad includes three things. One is our what? GIST, and another, right? One is our GIST, another is what? Another is our pulmonary involvement, that is what? Pulmonary what? Chondroma, right? Pulmonary chondroma, and another thing that is paraganglioma, right? P-A-R-A, para, G-A-N, gang, L-I-O-M-A. That means here we're talking about paraganglioma, which we discussed right here, right, in Carne's strategies, right? But here there is not the presence of succinate dehydrogenase mutation, right? Here we have what? We have GIST, we have paraganglioma, and we have lungs involvement, that is pulmonary chondroma, right? Okay, now this is what is our Carne's triad. Okay, now we talked about what? We talked about various genetic mutation, right, which will take place in the case of our this GIST, and in sporadic condition we talked about the most common is our CCAT, and then platelet derived growth factor alpha mutation, we have succinate dehydrogenase mutation of subtype BCD, right? And while talking about these things, we correlated these things with paraganglioma, and that is our Carne's strategies, right? And then what we did is we just differentiated these Carne's strategies with Carne's triad. Okay, now going toward the content that is written right here. Okay, talking about pathogenesis, what we said, okay, it is because of what? CKIT mutation, right? And platelet derived growth factor alpha mutation, right? Similarly, there are several, our succinate dehydrogenase subtype BCD, but it is not mentioned here. It's all right. And another thing is that yes, our this what? Carne's triad is mentioned right here. That includes gastric what? GIST, we have pulmonary chondroma, we have what? Paraganglioma, right? Yes, we mentioned about these things. Now what are the other things that we are going to study is, now we will move toward what? We'll move toward diagnosis, right? We will move toward diagnosis. Now talking about diagnosis, what we have is, what we'll do, right? How we'll diagnose? Okay, talking about what? Diagnosis. Now diagnosis, right? Diagnosis. Okay, talking about diagnosis, what we can do is the diagnosis, choice of diagnosis is our CT scan, right? What is the choice of diagnosis? The choice of diagnosis is our CT scan, and there are two types of CT scan. One is our normal, another is our PET CT scan, right? Okay, what we can do? We can do, okay, this is the identification of choice, and that is our what? CT scan, right? And another is our PET CT scan. Okay, now this was what radiological investigation. Now talking about another, and that is what? That is our what? Gross. Now we'll watching grossly, what we'll find is, we will find what? Solitary fleshy mass, right? And that will be having rolled appearance, right? Right here you can see what is this? This is the gross diagram, right? Now grossly these things will be seen. Now moving toward another. Now what is the another condition? The another is, we will what? We will have microscopic examination. Okay, talking about microscopic examination, what we'll find is, we'll find what? We'll find three kinds of cell. One is epithelioid, right? Epithelioid cell. Another is what? Another cell that we'll have is, we have what? We have what? Spindle cells, right? SPINDLE, spindle cells. And another is, we have mixed of both epithelioid and spindle cells, mixed cells. Okay, now among these three, right, among these three, these spindle cells are most what? These are most characteristics finding, so what we'll do, we'll focus on spindle cells. Okay, here you can see, right, these are what? These are the spindle cells, right? You guys can see longitudinal spindle shaped cells. Okay, it is more clear, I think it is more clear, right? It is also, yes, you can see right here, these are spindle cells, right? Yes, these are what? These are our spindle cells. Okay, or we can just have a look toward what? Toward our okay, that's all, right? These are the spindle shape. Okay, let us move toward the content. Okay, gross pathology, what we'll see is, we'll see well circumscribed fleshy mass, right, that we have seen right here. It is what? Fleshy mass that is solitary, right? It is rolled, of rolled appearance, right? Now talking about what? Talking about microscopic finding, right? H&E staining, what we'll find is, we'll find spindle shape, right? And spindle shape cell is the most common finding, right? Spindle cell is the most common finding, as you can also see right here. These are the most common finding, right? And we can also see epithelioid cells, and we can also see the mixed type of cells, right? Okay, now we talked about what? We talked about diagnosis, right? Now after talking about diagnosis, right, okay, we talked about what? We talked about diagnosis, and we mentioned about what? We mentioned about radiological, gross, microscopic, but there is also what? Immunohistochemical markers. There are immunohistochemical markers, right? Now these help in what? These help in what? These help in finding, right? These help in finding our what? Gist through several markers. Okay, now we're getting before our what? The written content, I would like to mention about what? Okay, now as we have already said that there is what? There is CDKIT, right? KIT mutation, or this CDKIT mutation is also called what? CD117, or it is also called CD117, right? Okay, now what we'll do is, yes, we said that this is what? This is the most common finding, but right, the best marker recently discovered is our what? DOZ1, right? This is okay, this is DOZ1. So this is the best marker. What is this? This is the best marker for our GIST, right? Now what is this DOG1? This means, this stands for diagnosed on what? GIST type 1, right? Diagnosed on GIST type 1, right? Okay, this is it, that what is stand for, right? Okay, and what we have is, yes, this is the best marker. Okay, there are other there are other marker also, such as what? CD34, right? CD34. Okay, I would like to take you toward back our classes. CD34, it is also where it is found? It is also found to identify our what? Hematopoietic stem cells, right? We were also finding these things in hematopoietic stem cell. So yes, we talked about what? We were talking about immunohistochemical markers. Talking about immunohistochemical markers, we said that what is this? This is our CKIT, or this is also called CD117, and it is the most sensitive one, but the most specific and the best marker is our what? DOZ1, right? DOZ1, and there is our CD34 also. Now we talked about what? We talked about immunohistochemistry. Now I would like to take you forward. Right now, the thing that I would like to mention here is, now okay, now we will find out whether our this gastrointestinal stromal tumor is having good prognosis or bad prognosis. Now talking about its prognosis, right, now we will determine its prognosis with the help of what? Tumor size. If the size of tumor is less than 5 centimeter, it is having good prognosis. But if the size of tumor is having more than 10 centimeter, right, it is what? Bad prognosis. Similarly, location, right? If our gastric, right, if our gastric GIT is present in our what? Stomach, or what I mean to say is, if gastrointestinal stromal tumor is present in stomach, right, stomach, then we will what we'll do is, we'll find it as a good prognosis. It can be cured so well. But if it is present in what? Intestine, small intestine or large intestine, then it is having bad prognosis, right? Yes, if gastrointestinal stromal tumor is present in what? Gastric stomach area, it is having good prognosis. Similarly, if it is present in intestinal area, then it is having what? Bad prognosis. Now talking about mitosis, right? If there will be higher mitosis, or if the mitosis index is higher, then what? There will be obviously bad prognosis. It means what? The cancer has what? It has exceeded in largely. But if the mitotic index is what? Less, or it is smaller, then what? It is of bad, it is of good prognosis. So here, if it is what? Greater than 10, then we call it as a bad prognosis. So this was about what? This was about prognosis criteria. So okay, now let me see if I have missed out something. Okay, one important thing that I would like to mention right here is, okay, since we talked about what? We talked about diagnosis. Now let us talk about its treatment, right? Talking about its treatment, the treatment, for treatment what we will do is we will provide tyrosine kinase inhibitor, because it was all happening because of excessive tyrosine kinase, right? So what we'll do is we'll provide tyrosine kinase inhibitor, and that is what, that is our imatinib, right? Imatinib. Okay, this is our what, this is our drug of choice for our what, our this what, gastrointestinal what, stromal tumor, right? And this is also used in the case of, if you remember, this was also used in the case of what, lymphomas, right? Okay, now another thing that I would like to mention here is, okay, since we have mentioned that our what, this gastrointestinal stromal tumor, it is what, it is most common what, mesenchymal tumor, right? Mesenchymal tumor. So it is malignant in nature. It is malignant in nature. It is malignant in nature, but it is not having what, it is not having any lymphatic spread, right? It does not have metastasis through lymphatic route. So what I'm saying is, it is not having what, lymphatic spread, but it is having what, hematogenous spreading, right? Okay, now if you remember what, if you remember adenocarcinoma, right, just before the first lecture, right, just lecture before it, right, adenocarcinoma, then you will find that adenocarcinoma is having what, involvement of both things, right, hematogenous and lymphatic spread. But here it is differentiated. Here our this gastrointestinal stromal tumor is differentiated from our adenocarcinoma in not having lymphatic spread. So that is one important point that I would like to mention. Now other thing is, okay, now talking about what, okay, I think we mentioned all these things. Let me see if there are anything remaining. Okay, now here, yes, clinical clinical manifestation. What will be clinical manifestation? There will be what, there will be stomach ache, right? Stomach pain will be there if it is present in what, our stomach region, then, right? And other thing that I would like to mention here is, okay, that's all. Okay, in a nutshell, what, this will happen because of increase in activity of tyrosine kinase, right? Increasing activity of tyrosine kinase and that will cause what, increase in cell proliferation, and increase in cell proliferation will eventually cause our cancer. That's all. So okay, yes, this much for our what, gastrointestinal stromal tumor. We came through all these things. I hope it's clear to you. Thank you and have a great time.